Coronary Artery Bypass Graft, CABG, surgery, commonly referred to as bypass surgery, is a complex surgical procedure performed to improve blood flow to the heart by bypassing blocked or narrowed coronary arteries. Here is a general overview of how CABG surgery is typically performed. Anesthesia. The patient is first given general anesthesia to ensure they are unconscious and pain-free throughout the procedure. Incision. The surgeon makes an incision in the middle of the chest, typically 8 to 10 inches long. In some cases, minimally invasive techniques may be used, resulting in smaller incisions. Accessing the heart. The surgeon uses a surgical saw to carefully open the sternum, breastbone, allowing access to the heart. Connecting to the heart-lung bypass machine. Tubes are connected to the major blood vessels, and the patient is connected to a heart-lung bypass machine. This machine temporarily takes over the pumping action of the heart and maintains oxygenated blood flow to the body during the procedure. Harvesting blood vessels. The surgeon selects a healthy blood vessel, usually the internal mammary artery from the chest wall or the saphenous vein from the leg. These vessels will serve as grafts to create new pathways for blood flow. Creating grafts. The selected blood vessels are prepared for grafting. The surgeon may remove any fatty deposits or diseased portions and cut the vessel into appropriate lengths. Bypassing the blocked arteries. The surgeon carefully attaches one end of the graft to the aorta, the main artery leaving the heart, and the other end to a point below the blocked or narrowed coronary artery, creating a detour for blood flow. Reconnecting blood flow. Once the bypass grafts are in place, the heart-lung bypass machine is gradually disconnected, and the blood flow is redirected back to the heart. Closing the incision. The surgeon closes the incision in the chest using surgical wires or sutures. In some cases, small drainage tubes may be placed to remove excess fluid from the surgical site. Recovery. The patient is transferred to the intensive care unit, ICU, for monitoring and recovery. They will typically stay in the hospital for several days to ensure proper healing and progress. It's important to note that this is a simplified overview, and the actual procedure may vary depending on the patient's specific condition and the surgeon's approach. CABG surgery is a highly specialized procedure that should only be performed by trained and experienced cardiac surgeons in a controlled medical environment. If you or someone you know requires bypass surgery, it is crucial to consult with a qualified cardiac surgeon who can provide personalized guidance and determine the most appropriate treatment plan based on individual circumstances.